it is a great pleasure being here today. Thank you so much for inviting me. This is something that I'm very, very passionate about. I am a physician background, but I've been working on innovation for a long, long, long time. So being at the Conference Board of Canada over the past few years has helped me to, given me the chance to focus on very important initiatives that are very central to my heart. My presentation is kind of different from the others we have heard. I have heard a lot from entrepreneurs and their perspective on what they can do from their side of the spectrum to advance the innovation agenda. I'm going to focus on the policy side and how governments can foster better environment that is more welcoming for those companies and those innovations to grow. Yeah. Very quickly, an overview. I'm going to just very briefly talk about the Conference Board because many people still don't know who we are and what we do. Also quickly talk about Canada's innovation performance. I won't go into a lot of details because we had a few slides and a few comments about that yesterday. But I will present the overall benchmark and how we stand with our OECD peer countries and what are some of the implications of that for healthcare. Talking about health innovation procurement in the United Kingdom and Canada, that will be the most important focus of the presentation. That's coming from our most previous research. Actually, this is a preview for you because the report is not public yet. It will be in a few weeks. It's now in publishing. But I wanted to share with you some of the key lessons that we have learned from studying what's happening in the UK and from studying some of the attitudes and perceptions of Canadian healthcare administrators about health innovation and the role of procurement within our health innovation system. And last, just a few thoughts on recommended actions based on the lessons learned. So Conference Board, who we are a not-for-profit organization. We don't work for, we are not government. A lot of people think that we are not. We do a lot of contracts for governments and we work closely with governments, but we don't necessarily work for them. We have different knowledge areas. We are specialists in economic trends, public policy, and organizational performance. And we have several initiatives focusing on health. The one that I lead is the Center for the Advancement of Health Innovation, which is it's a public-private partnership between different governments, provinces, jurisdictions, and also people from industry and university and healthcare organizations, and that's what we call the health enterprise. We are promoting a system view of health innovation, and within that view, all those stakeholders play a very critical role. And without each one of them, I don't think we can foster public policies that make sense and that will bring us to the point we want to go. We also are launching the Canadian Alliance for Sustainability of Healthcare. It's a really broad initiative, so you will be seeing a lot of outputs from that one. It will receive a lot of media attention. So over the next 2-3 years, there will be a lot coming out from us in this area. 6 other research centers focusing on health and healthcare and multiple research projects that we do. I lead primary care efforts as well, so if you have an interest in primary care, let's talk about it. Okay, so first, what is innovation? And I wanted to start with this because very frequently I find myself talking about innovation with a group of people and we all have very different understandings of what innovation really means. In healthcare, it's not infrequent, and within academic circles as well, that innovation is kind of the same of a new idea or an invention. And from our perspective, this is not good enough to be called innovation. Innovation only can be called an innovation when you extract value from those inventions or those ideas. And that's extremely important because the lack of clarity on this has misled somehow our focus, our public policy focus on innovation in this country. If you look at our public policies around innovation in Canada are not innovation policies, they are invention policies. They support research and development extremely well. And I'm not suggesting that we should not do that. I mean, I think it's important, and without the research and development investments and the focus on basic research, you will not have innovations. But that's not enough. It's not good enough. And I'm really hoping that we can talk about it at some point this afternoon or today. So overall, our innovation performance sucks. It's really, really bad. I mean, how can I put this? We are at D. What type of aspiration is that? When my kids bring an A, I'm asking them, you can get an A+, what happened here? So D, it's not really making me feel very great. But the worst part of it is that we have had the same ranking since the 1980s. So despite our efforts over 2 or 3 decades, we haven't been able to actually make significant improvements. Not because we haven't done anything at all, we have. And in fact, a few areas have been improved. The challenge is that the improvements have not been good enough because our competitors are also improving. So in proportion, when we keep comparing with them, then we are still a D. So what this is telling me is that we really need to rethink our innovation strategy and our innovation focus, because obviously what we have been doing is not working, particularly in the health sector where there is so much potential. We have everything here, all the ingredients to be extremely successful, and here we are not reaping the benefits of that potential. The bottom line is that this affects our productivity. So this slide is actually a little old. We did that. It's a projection from 2001 to 2005, our overall productivity growth, but have not changed much. We're still under 1% of growth overall. And if we compare that, this is Canada here, and this is the average for the OECD countries. So we are under average in terms of productivity growth. And look at Ireland and US and Sweden and Norway and Japan and Finland. And by the way, so Sweden, Norway, Finland, UK, well, the UK maybe less, but definitely Finland, Norway, and Sweden and Japan are countries with high-performing health systems according to our own benchmarks as well. So there are some correlations here. Now, why is this important? It's very, very important, because what this is telling us is that we're working harder than those nations, and we are not getting the same out of our work. And that is affecting our standard of living, and it's affecting the quality of the services that we have in Canada, and our ability to create wealth to pay for the health services that we all need. This is the bottom line. This is why this is extremely important. Now, we have studied this we have tried to study this many times, and there are many opinions on why this slow productivity growth and why the huge productivity gap between the US and Canada. One of the things that is coming, and that's one of the most important from our perspective, is that we are a very slow adopter of technology. And that is not only on healthcare, it's for Canada overall. So the problem is that we are not investing enough money on new technologies, machinery, and equipment that it allow us to increase the productivity of our sectors. So you'll see that this theme is not really owned by the healthcare sector. It seems to be a Canadian problem. So it's how we can tackle that within the healthcare system. It's a real challenge. So innovation is also very critical for healthcare, and why is that? Well, I won't go into a lot of details, but this is the average per capita public health expenditures by age category. If you see, not surprising, and we know this, the highest expenditures go to the 65 and older in our population. So in 2006, that population group was about 13% of Canada's total population. And that in 2006 accounted for 44% of total healthcare cost. So imagine this, 44% of the total healthcare cost is coming from 13% of the population. By 2030, that population will almost double to 22% of the total population. Imagine the impact on the healthcare cost. And we keep listening that, well, not all the seniors have to be ill because they are more active, they are eating healthier. That might be true, but I really doubt that we can see huge differences between now and 2022 in terms of population health. If we look at the demographic trends, we know that 60% of Canadian population right now is overweight. And a quarter of the Canadian population is really obese. So the impact on chronic diseases, I don't think that's something we can take very lightly. So how is this affecting the provincial governments? Well, we know that the proportion of their budgets, is this what? Yeah, it's working. The proportion of their budgets that they expend on healthcare is growing, and it's getting to 42%. 43% on average. Some provinces are already spending 50% of the total revenues in healthcare. So you can imagine how this is really not sustainable, because if we keep spending this on only healthcare, what's going to happen with education and innovation and all of the other things that are also important for our society to prosper? The challenge is that despite how well we did during this world economic crisis, and Canada did very well in comparison to other countries, we are still forecasting deficits. Enough for all the provinces to be on the red until 2014 with significant unbalances. The federal government is probably going to do better, and we are expecting them to balance their books by 2014. But that is also adding to the challenge of the provinces. So we had a healthcare forum a few weeks back, and that was the bottom line of those conversations. It was a group of people from healthcare organizations, mostly hospitals and regions, and some providers as well. And they all recognized that really what the key for healthcare sustainability was innovation, productivity, and transformation. Those were the three words, the three key themes that they identified should be the major focus. And we can look at it in our innovation policy toolkit. There are many things that we can do to support this. But at the end of the day, then we need to start looking at it. So this is where innovation procurement actually is coming to our conversation. Innovation procurement, so this is not new. Actually, kind of big humor. This is true actually in many places, I guess, which is sad. Sadly, this is not only a cartoon. So what is innovation procurement? Innovation procurement is not new. It's a concept that has been around for a long, long time. In fact, innovation procurement was the propulsor of huge industries like computer and the aerospace industry actually were the ones that came because of a strong focus on research and development in the US through innovation procurement many, many years ago. Now, the interesting thing is that over the past 10 years or so, 7 to 10 years, I have seen a very strong focus of OECD countries on innovation procurement. And OECD is encouraging all their countries to look at innovation procurement as a tool to help them to use. They have estimated that on average, OECD countries spend about 16% of their GDP, which is quite a big amount of money, 16% of the GDP in acquiring, purchasing products and services. So the argument is there a way that you can use that purchasing power to support the development and commercialization of innovations in different areas? Healthcare has been one of the areas that has been mentioned as one of the most potential, and it's also green technologies and clean tech. And this is where the majority of innovation procurement is actually happening. So this is, in a nutshell, the idea. how is innovation procurement seen? So basically to play three major roles. In situations when there is a need, but there is no commercially available solution, there is nothing. So think about it, cancer, think about something to cure obesity. There is no solution, but there is a huge need. Then pre-procurement is used as a pre-commercial procurement, a research and development contract that will encourage government and private sector to share risks and to support research and development through procurement. So there are a few examples of that, and this is actually how the aerospace industry took off in the US. Then also situation when there is a need to enhance supply relationships to rapidly exploit innovations. What this means is that sometimes the need is there and you have pieces of the solution, but somebody has to put them together, and they can be put together relatively quickly. So what they do is that they encourage the private procurement of those companies to prepare a finished product quicker, based on meeting the needs that are specified by the government. Or there are situations where innovative products already exist, you have them, but the problem is that they are not being utilized. There is zero uptake or very limited one, and therefore you are not reaping the benefits of those products. And then you use procurement to support that market uptake. So through these three key roles, then we can see that procurement processes are actually improving the quality of services, improving business investments in research and development, and improve economic activity. And all of these, of course, will result in health system performance and country competitiveness. That's in a nutshell how it works. Now, I'll give you, so I'll focus on the UK because, yeah, it sounds great, but is this actually being used in healthcare, and what are some of the successes that we have seen? And that's why we focused on the UK. There are different countries that are doing things in other areas. I mentioned clean tech, for example. The UK is probably the country that has embraced innovation procurement in healthcare the most amongst all the OECD countries that I have studied. So they have totally transformed their system based on innovation procurement. They have created new organizations, reorganized the system, created new accountability mechanisms, and there have been really massive efforts to integrate innovation procurement into the NHS. Let's have a look at that. This is the regional approach to technology-led innovation. Basically, this is the regional commercialization focus that was created and adopted in the UK. Basically, one of the things that they did first is that they legislated, and I'm going to mention this again, legislated, mandated innovation to the healthcare regions, which is really bold and has been extremely important. Until now, so if you think about it, there are innovation hubs everywhere, even here. So the Ministry of Research and Innovation in Ontario is promoting, we have centers of excellence everywhere. We have that. The problem is that there is a disconnect between these regions, these hubs, and the healthcare system. This is what the UK actually solved. So they created this, and they said, from now on, the regions are mandated to innovate, and they have to submit an accountability report at the end of each year. So all the primary care priorities and the vision of the strategic health authorities over 10 years and the quality and productivity goals that they have recognized for the NHS, and of course all the operating framework, have to fit into the needs for the regions, and then each region have to identify their own priorities. So they created these commercial support units, and what they do is that they really manage the innovation procurement at the region to ensure that all the innovations that are going to come from that particular region are going to be addressing their particular needs. Some of the activities around procurement were also, some of them were kept at the central government. but a lot of the ones related to innovation, for example, the collaboration, the one point of access for industry into the region, those were left with the regions itself, and they created these UNIPs or innovation hubs. Now, the other interesting part is that they identify different processes. If you have innovations that are not being taken up, then they mobilize procurements to speed up adoption. And there are particular processes to support that. But they also identify if there are new opportunities for innovation and how can we involve our NHS staff and our region staff and clinical providers and work with the technology companies to develop these commercial procurement programs. So there is a process identified for that. And over that, of course, we have the guidance of the Department of Health, which is the parallel of Health Canada here in Canada, and other central government agencies that are supporting the regions in achieving that innovation mandate. Something extremely important in the UK to make all this system work was a strong focus on enhancing the skills of everybody. And everybody, I mean from board members of the trust to managers to clinical staff. So it has been a very strong focus on developing the commercialization skills. They recognized that they needed to act and behave more like entrepreneurs, and they identified that there were some skill gaps, and they focused on it. So very strong focus, and without that, I don't think they would have been able to move that innovation procurement agenda. So I'll give you 3 examples of, okay, so how is this really working? What is the evidence that this is working? And this is a fascinating story, actually. Adoption of digital signal hearing aids. In 1988 or 1999, the Royal National Institute for the Deaf, which is a not-for-profit organization, recognized that there were about 2 million people in the UK that needed hearing aids. Now, the problem was that they were not being provided within the public purse. The NHS was not providing them because they were expensive, and there was not a particular program to reach them. They were providing the old technology, the analog technology, and about 1/3 of all the people who were using the analog technology actually were not using them at all because there were many problems with those devices. They couldn't be customized properly. There was a lot of noise. People couldn't follow a conversation, so they decided not to use it. So that was actually a waste of money, resources that were being paid into a technology that was not providing benefits to the people who was using them. So then this organized, oops, I'm so sorry. This group, what they did is they did their homework, and they thought, well, what about, well, at that point, the digital signal hearing aids were only acquired by private purchasing. Sometimes they were covered by private insurance. And they could be very expensive, even to the point that some of them you could have paid £2,500 for each one of these devices. So this organization did their homework, and they said, okay, how about if we create a market and if we use procurement to make sure that this innovation is being updated within the NHS? So if we create that market for particular companies, what type of prices can we negotiate? And how we can make sure that we bring access to these devices to the people in the UK. So they estimated that for the cost of about £75, they could have some of the basic devices. So they started arguing with the government that £75 was actually less than the cost of 1 day in hospital. And with that investment, they could significantly enhance the life of many people, 2 million people in the UK. So that was a no-brainer. You know, this is something that you can actually change the life of somebody if they are listening well for only £75. So It was not easy, of course, not an easy sell, never is, but they created a huge public relation campaigns. It was a lot of media coverage. They wrote thousands of letters to the parliament and the ministries, and it generated 2 days of discussion in question period in the parliament. The result was a commitment of the government of £125 million over 5 years to adopt this technology. Now, the government actually did something unusual, and they named the Royal National Institute for the Deaf, a not-for-profit organization, the project manager on this strategy and the deployment of this. So from 2000 to 2004 or 5, in only 4 years, they went from not prescribing the digital hearing aids at all to prescribing all of them to the right people. And I have to emphasize the right people, because very shortly after they started implementing this, they realized that the demand was so huge that they couldn't cope. So that was a really eye-opening, and really started to increase the understanding within the NHS that innovation is a system. So what happened is that, yes, so we have the technology. The problem is that they didn't have enough audiologists trained within the NHS to use the same technology. They couldn't fit the devices. So it really created huge waiting times. So they have to revamp training and development, working with the NHS trust, with the hospitals, with the audiologists, the professions. It was a system perspective and a system approach that actually led them to be successful at the end. Very challenging, but very rewarding as well. This is another example. So the Yorkshire and Humber Strategic Health Authority is a it's a relatively small strategic health authority. It's smaller than probably a province, if you want to look at it that way. It's relatively new. They started in 2006, and they were given this innovation mandate. If you look at their goals for the region, innovation is not one of the goals, okay? One of the goals of the region is improving health of the population, reducing health inequalities, and the other one is, if I remember, they're all health related. Now, they used innovation. They really understood that innovation was an enabler for them to achieve their healthcare goals, and they have focused very heavily on innovation. Very impressive that since 2006, they have received 846 new ideas, assessed 408 and supported 58, have supported the development of 50 technologies with a market value of 81 million, have supported the development of 5 spin-off companies, raised close 3 million venture capital funding, and partnered on research and development contracts to the value of 55 million. Very impressive for a health region. I wish our health regions would behave this way. So this is actually an example of one of the products that is coming out from that region. Silico is one of the first spin-off companies, and they focus on this is a device, is a probe to support cervical screening for cancer, and this is a point-of-care real-time results. You don't have to wait. The device will tell you whether there is a cancer or not, reduces the false positives, and as well reduces the need for biopsies. So they have estimated that this device only will help the NHS to achieve about £40 million in savings from tests and other things that they don't have to do it anymore. Very impressive. That's the last one that I want to share with you. The Health-Associated Infection Technology Program. So in 2000, has been for a long, long time, but they started focusing on the need to find a solution to the hospital-acquired infections, because it is a big deal. And in the UK, a lot of people die from that every year. You go to hospitals to get cured, not to get sick, and in many instances, you die from being at the hospital. So what they did is that they involved over 500 staff from the NHS clinical providers from different groups and centers and professions. They also involved the administrative staff, the clerical staff, everybody. And they identify some of the areas they need to be addressed, and hospital-acquired infection was one of them. Then what the NHS did is that they called the College of Design, and they said, well, we have a problem, can you help us with that? And the College of Design did, over a few months, interviews with hundreds of people, providers, janitors, porters, patients, about all the processes or the activities that they did that they found problematic. From all those interviews, they identified 11 areas that they need to address. And then through competitions, they use kind of the innovative procurement, which is when you have not an off-the-shelf solution, but you have different pieces that could be put together in place to launch a competition for different teams to find solutions for these 11 main problems. So one of the porter chairs was one of them. They recognized that this chair has not changed since the 50s. And all the janitors recognized that they were very difficult to clean, and very difficult to use, and that they needed something new. So what happened is that a group of people from different areas, different disciplines, microbiology, anatomy, people from NHS, so users of the products and companies came together, and 11 products were prototyped with, so 11 products were selected from the competition, and then they gave £25,000 for the development of those prototypes. Now, last year, those prototypes were through the NHS. They were exhibited there, and the people had the chance to test them, and now they are on the market. So very shortly, we should start seeing them, that uptake. One of the things that they had is, as part of the competition, is that the resulting products should be the same or similar price to the existing ones, so that to ensure that the uptake within the NHS was going to be successful. So what did we learn from the UK? Well, first is that there was a very strong commitment from the central government. So we know that the central government said, this is the direction we are taking, and this is all the support, and this is how this is going to happen. Then they gave the regional mandate to innovation, to the regions, and they connected the dots within the healthcare system, and they targeted the funding for innovation. So this would have never been possible without the funding. So they spent about £350 million over 5-6 years in supporting this type of competitions and uptake and training of the NHS staff, and also training for new technologies and enhancing their skills. All that money were spent across different things just to achieve the goals. And of course, the strategic development of all talent at all levels, and I talked about that. Now, after we did that, and we've been talking to the UK for about 2 years, and looking at, so what's happening in Canada? And yes, I know about bulk purchasing, and I know about some of the provinces coming together, but when you look at the public policy documents on procurement in Canada, you don't really see innovation procurement appearing anywhere. So we ask ourselves, so what's happening here? Like, obviously, Canada is reading the OECD documents, and the OECD is encouraging Canada to take on innovation procurement. Do we really know what that means? Do we really know how is this being implemented within healthcare? So what we did is we launched a survey. Of course, we did a lead review. We found almost nothing. We did some interviews in Ontario, so there is a small case study, and that will be in the report once it's out. But we were very, very interested in knowing what are the attitudes and perceptions of our healthcare administrators towards innovation procurement. What do they know about it, and what do they think about it? So we launched this survey, and it was a Canadian survey. And all the provinces were, 7 provinces responded. The majority of the responses came from Ontario, BC, and Alberta. But we were happy to see that we also got responses from all the 3 territories. So this is actually highly interesting. So there was almost overall agreement that innovation is essential for the sustainability of Canada's healthcare system. We asked them about, is innovation recognized? Is innovation important for the survival and improvement of your own organization? Almost unanimous agreement. Now, the level of agreement starts going down when you ask them about how do you actually practice innovation. Is innovation a recognized priority at your organization? Less people feel strongly about it. And when you asked if procurement policy could support Canada's goal of becoming a world leader in health innovation, even less people. So it's kind of interesting. Yes, it is recognized, but we're not necessarily doing all about it, and I'm not so sure what is the role of innovation in all this. We asked them the importance of innovative products for their own organizations, and 60% of them said that innovative products were very important or important for their success. But when we asked them about the procurement approaches and how they support the development and uptake of innovative products and services, more than half said that they are not supporting the uptake. So fairly interesting. Yes, we need them, but our processes are not working. So then we asked them, what are some of the barriers for the uptake of innovation? So they talked about rigid procurement processes and rules, which, yeah, so yes, but I think it's overrated. Lack of appropriate skills among the staff, which is something also very important that was found in the UK, and that's why they addressed it. Lack of organizational interest in innovation and too much focus on cost reduction and standardization. The top 3 most important elements for the evaluation of selection of tenders, so we gave them a list of 9, and we asked them to add any other if they thought there was any other that was not within the list. It was quality benefits, price, and cost effectiveness. Yeah, so which is interesting. So we were looking at what are some of the other characteristics that could be included within the assessment of tenders to enhance that we get better value for money. And those are here on this part of the list. User-centeredness, technical merits, innovative functionality, even whole life cost. But they were not at the priority list for our administrators. So yeah, that's interesting. We asked them what are some of the areas where we need to improve, and we looked at the areas that were rated, that got actually the lowest ratings within the survey, and those were the things they said. So engagement of patients and providers, communication of innovation plans to the market, all of the things that we have been discussing for this day and a half that are extremely critical to lead to innovative products that can transform healthcare. We don't do that very well. Yeah, I'm wrapping, sorry. Key lessons. Well, we know that innovation and procurement are still disconnected in Canadian healthcare. The survey actually showed that there is a reluctance to take advantage of the supply of innovative products, the ones that are available, but also it's the inability to express the demand for innovative solutions, which we have a dual problem. And of course, the risk-taking issue that we've been talking about and its characteristics of Canada, very, very evidently. So where do we go from here? We think that we need to start from having a national health innovation plan. We don't have one. And I need to underline innovation is not an invention plan. We need an innovation plan, really focused on commercialization. And if commercialization is a key role, then innovation procurement should be part of that. Now, what do we need to do to make sure that innovation procurement is actually successful within that plan? Well, there are a few ideas that I'm putting out. I think that we need to have some federal leadership on this. Obviously, the approach that we saw in the UK was a top-down approach, and it's easier in the UK given how they are organized, their healthcare system and their government. It's a little bit more difficult in Canada because of the jurisdictional differences. However, it's not impossible. I think that our efforts in primary care between the federal government and the provincial governments have demonstrated that we can work together whenever there is a good plan and goals. Now, the 2014 Accord provides a great opportunity for the federal government to step up and to demonstrate leadership and make sure that innovation is part of the goals that the healthcare system should be pursuing. I'm just saying, maybe consider a National Health Innovation Office. We need to have a mechanism to oversee progress. Don't leave that out to everybody to do. So maybe centralize that and make sure that we have somebody who is accountable for results at some point. Really makes sense in my mind. Targeted funding for innovation, and to do all those three things, extremely important. Without that, I don't think we'll go very far. The regional implementation, extremely important again, and we know that innovation happens in clusters. We already have some clusters, very important in Canada. We just need to make sure that they are connected with the healthcare system and address the culture and attitude. So a lot of education that have to be put in place to empower people to behave differently.